I'm the county resident from District 3, and this consolidation idea, which Mark just pointed out, is not about cost saving and efficiency exclusively. It's about better care. I think is worth supporting as we roll it out. I think looking at it in a year and seeing how that goes is going to be interesting. The priorities are deep. I mean, we're going to work on the diversion of corrections involved individuals to community-based programs and services. We're going to work on the overcrowding of emergency departments by individuals in psychiatric crises. Housing and supportive services for homeless consumers, that's critical. Access to culturally and linguistically competent programs and services, which sounds good. Implementation of the expanded substance abuse disorder benefit, which sounds reasonable. Vulnerable children and transitional age youth. This would be a good area, since we're working on integration, to bring together the public health nurses and the DCFS nurses, which, as you recall, was structurally impossible last time we looked at it. And then, of course, there's chronic disease and injury prevention, which is another one. And, you know, a word about Dr. Katz, obviously. I mean, this is a very likable guy. This is a guy who works extremely well with others. And so I see the impetus for putting him in that kind of a position. And, you know, and I hope it works well. I mean, there are some frothy assessments of how it's going to go. One, the three things that caught my attention that, you know, sound a bit idealistic are that the agency is going to avoid bureaucratic processes. That would be good, because that is, of course, what we're dealing with. And the agency is going to respect current department relationships and commitments, important, but again, easy to say, how does it happen? And finally, the roles and the responsibilities of the board-appointed commissions shall remain unchanged. And that one, I have to say, I don't understand at all, because if we have all these other commissions still intact, how can we have a streamlined approach? But again, you've got a lot of big thinkers on this, and as I go, I just want to thank the CEO and her team for putting together that budget today, despite the fact that you know, it's a budget, so there's going to be criticism. They did a decent, transparent job. Thanks.
Thank you. Mr. Sachs.
Yes, thank you.